Communities especially plagued with problems such as opioid addiction, gun violence, gangs, academic failure, etc., are currently seeing an influx of new programs and other investments from various sources. The evidence, however, which many of you have spoken to today, the evidence does not consistently support their effectiveness, and in most cases, communities are not seeing sustainable change. How can or do you as leaders in the field help to direct other foundations and government from the top, policymakers as well as agencies, to appreciate what is evidence-based, thereby increasing support for and utilization of research and implementation of evidence-based practices?
Okay, well, I'll take a crack at that. It's really a two-part question, one about communities not seeing sustainable change, and the other about what foundations and government can do. So with respect to communities not seeing sustainable change, this is not necessarily a reflection of ineffective programs. This is at least as much a reflection of the challenging times we live in, with rising inequality, with large swaths of our country left behind by the economic recovery since the Great Recession and the expansion of inequality, which has been going on since around 1980. So, you know, we have the opioid crisis, as has been mentioned several times. We have poverty, we have persistent poverty, we have challenges in our education system, we have challenges in our judicial system with greater attention to existing racial inequalities than has ever been evident before, even though that's not new. So we have some effective programs, but they're facing an increasingly challenging environment. Now, what can we do to get folks to appreciate evidence-based programs? That's what our use of research evidence portfolio is about. The science of knowledge utilization. And what we've learned is that far more important than the quality of evidence is the quality of relationships between producers and consumers of evidence and the intermediaries who often bring them together. So fostering these relationships and developing research questions within these partnerships is a key to getting evidence from research used in policy and practice.
So, if I could give the correct answer to your question, I think partly it is what you said, that the, but partly
well, that's generous of you, John.
Partly it is a reflection of the fact that a lot of programs that are being tried, if they were rigorously evaluated, would be found not to produce the hoped-for effects. So it's some of both. I think the most promising path forward for these communities is if government funding streams at the state level, the federal level, the local level, make evidence the defining criterion in what gets funded. So maybe there's an evidence-based program, a promising program, or if they're lucky, a program backed by strong evidence. The criteria for whether you get, as a state or local entity, get funding from the state government or the federal government should include whether you are implementing a program faithfully that has some evidence behind it, and or whether you're including a rigorous evaluation to determine whether it works if it's a newer program that doesn't have that kind of evidence. So I think one short answer might, at least the answer that I would offer, would be change the funding stream so that there's an incentive for building evidence and using evidence.
I would say I think there's room for some partnerships between organizations like the National Institutes of Health that I represent and some of the service delivery organizations, so making sure that we embed our research within real-world settings more than we have traditionally is a way to help shape this over time. But I'm certainly a believer in we will let the evidence emerge as much as we can, but people will continue to make ill-fated decisions no matter what we say at times. So I think we have to be willing to continue to put good information out there as clearly and in as easy to digest manner as possible. That's part of the reason I think not only is it the responsibility of our research groups to develop evidence, but also to figure out how to create understandable ways that it can be consumed by policymakers and practitioners and the public.
I think the only thing I would add to all of this, and maybe take it in a little bit of a different direction, is most of the programs we've been talking about are focused on individual behavioral change of some kind. If we're really trying to move the needle in a significant way on issues as large as inequality, concentrated poverty, etc., these are primarily systemic issues. They're not individual behavioral issues alone. They're, at the very least, it's the interaction between the systemic issues and the behavioral issues. But to get large-scale change, some of our investment in developing evidence-based policy ought to attend to what it takes to make a systemic change. And one real quick example. I think the evidence is strong enough to convince me, as the former Commissioner of Juvenile Justice for a state, strong enough to convince me that incarceration of young people is a bad thing. We can greatly reduce incarceration of young people by changing how adults treat those young people. If we can continue to build the evidence on how to bring about that kind of systemic change, reducing incarceration of young people, we will probably get more bang for our buck, I would argue, than 12 additional child-focused programmatic interventions that might reach 10,000 kids, as opposed to the 53,000 on any given night are locked up.
Yes.
So it goes to John's point about being required to use evidence. You know, we have the Every Student Succeeds Act now, and we ought to follow that closely to see if what happens in those circumstances, whether or not the state and local agencies are really following through and making sure that there is some evidence of justifying the program. So it's something to watch in education.
So I'd like to open it up. Al, did you have anything you wanted to say? I don't want to put you on the spot.
No, I did,
You have to
thank you.
say.
The Al Faber, I'm the CEO of the Baldrige Foundation, and we are the private partner of the public Baldrige Performance Excellence Program at NIST. And so one of the things that we have done is taken the Baldrige framework, which has been used over the last 30 years to increase the performance excellence of business, education, and healthcare, providing national role models that we benchmark from, and applied it to communities through the Communities of Excellence Initiative, bringing together community leaders who establish mission, vision, and values and try and attack problems at the community level. One of the reasons is the opioid crisis. And one of our most successful communities is Charleston Area Medical Center in Charleston, West Virginia, specifically for that reason. And CAMC was a national award recipient. This is a disciplined framework by which to produce results. And my question to all of you is, where would the intersection be with what you're trying to accomplish, implementing strategies at the community level with this proven framework that could help bring those leaders together and move the needle?
Well, the first thing that comes to my mind is the Community Foundation Opportunity Network, which could become a partner, could at least want to learn more about that Community of Excellence initiative and the framework that it uses. It might provide a vehicle for the kind of coordinated national effort across the mostly small communities that are participating in this national network.
I guess I would take a small scale version of that and say, how about in Charleston? Have you done a rigorous study of how that model has impacted the opioid crisis in that area, and using that to train the community, to bring together a set of community partners to then implement multiple evidence-based approaches that are going to be necessary to address opioid crisis. In that hospital, they're taking care of a very high rate of neonates exposed to opioids. They also have the moms that need treatment, maybe not just during that 2 weeks, but how about for the following couple of years, because these are long-term term issues, the family support issues that may be necessary. There's a whole range of intervention possibilities. And that structural approach that you're talking about could be a way to implement it. We'd love to see that kind of test. So maybe somebody from Marshall could talk to me about writing a grant on that topic.
And that's all part of the discussion too, exactly what you just talked about. And we're working with Selma, Alabama, the school superintendent down there to implement Baldrige in Selma, Alabama, just for that reason. And I think there's a real close relationship to what you're trying to do there and what we could do.
Yes?
So, as a scientist, I'm all about evidence, but I do want to play the devil's advocate for a second. And I'm interested in the panel discussing when evidence gets in the way of action. For example, like a small school system or a small organization that maybe doesn't have the capacity to measure some of their programs. I mean, yes, we do need evidence, but John made a comment about requiring evidence for some of the funding for these programs, and that can be a limiter, limiting. If that's a requirement, a small organization might not be able to apply for those funds because of that.
And I'm not going to respond to the applying for the funds piece, but what occurs to me is a lot of our work with smaller organizations and community-based organizations and systems, helping them figure out how to measure their performance, how to measure their results. And I'm sure this picks up a little bit on the example that was just given, as an ongoing part of the way they do business, is stepping toward building the kind of sophistication about using data in order to get to evidence-based work. So using a framework like results-based accountability, results-based leadership, whatever you want to call it, but the notion of having all the partners agree, this is what we're trying to accomplish, this is how we're going to measure it, this is how we're going to collect the data, and we're going to change based on that data. That's kind of the core capacity that I think almost any organization can take up successfully.
If I could just give a quick response to your anti-science heretical question. No, it's a very good question, and I think it is possible. There has to be some creativity in there to have small communities participate in some of these studies. And just as one example, there was Wilson mentioned Prosper, which is a community-wide substance use prevention system and violence prevention system, which is implemented in small communities. And our foundation is funding a replication trial of that, where whole communities are randomly assigned. So the whole community, usually they have one school district in each community, one high school in each community. And so you can get, small communities working together to build evidence in ways like that.
John, would you have something to say?
I just wanted to add something, but it turned out to be similar to what Patrick already said, but I'll do this because he did that. So two thoughts. So the first is from the perspective of the Prevention Science Coalition. Evidence-based means based on evidence, right? So there's a lot of pushback out there that, Peter Orszag, who is the budget director for the Obama administration, famously said that less than 1% of federal government spending goes to evidence-based programs. My take on that is we're gambling with the rest of it. And I worry that the pushback to evidence-based programming and interventions is to say, let's do evidence-informed, which could then be well-intentioned things with a theory of change that isn't actually a testable hypothesis, or something that crowds out things that have an evidence base. So that's my main response to that. But I do want to say that I dabble in the impact investing world a little bit as a researcher. I don't have money to impact or invest. But I'm struck all the time that you have all these people who want to invest in things that work, that are evidence-based, and they want to do well by doing good and invest in making society better. And they're stuck in this framework where they'll only invest in things that at the end of the day have a rigorous, transparent, objective, maybe randomized controlled trial that demonstrate that the thing that they invested in works. And I say, well, that doesn't make any sense to me. Why don't you do what Patrick said and develop a good performance measurement system where the measures are indicators that you have implemented with fidelity to best practice, that you gone out, you've said, I've read the literature, I know it works, I know how to implement it, and now all I need to do is prove that I did the thing that they've already shown worked. That should be sufficient to trigger investment in one of these good ideas.
Does anybody else have a comment? We're a little bit over, but nobody's going to take us out. Go ahead, Wilson.
I am going to have to run.
Go, okay.
I'm at 4 o'clock at the Renaissance Hotel.
We're done.
You're late.
You know, go ahead, please. Yes, thank you so much. Yeah. Go ahead.
So one thing I think is important is there's a discussion about sort of, using evidence to fund programs and Congress use evidence. And this is sort of a question in the comment also, but I think it's important to realize that I don't think the answer is necessarily members of Congress and staff deciding that the evidence that this is the program to use. I think it's more about funding, trying to fund the purpose instead of the program. So it's saying, we want to reduce things. We want to increase graduation. We want to do something like that because it allows the flexibility in the program to change over time, where you don't end up with 21st century carriers that's someone's home district, had this person testify, it's a great thing, they want to do it forever, the person's chairman of the committee, it never ends, right? You have instead, we want to help kids who are struggling to do well in school, and then it goes from that one to the next one to the next one, and you don't have these high stakes bets going on where people are so vested on both sides. So I'd be curious to know, or get feedback after on ways that your organizations can help that decision shift from sort of up or down votes in Congress to agencies or tiered evidence or something, so those decisions are ongoing, and there's not as much of a threat, I think, sometimes.
Yeah, can I just comment on that? I agree entirely, and yeah, I think that is a way forward. That the overall goal is, improve reading achievement or whatever it happens to be, reduce homelessness. The legislation is set out with that broad goal. It doesn't specify or sort of circumscribe, you're going to use this approach and that approach, but it does specify that evidence is built into the grant-making process, both the use of evidence where it exists, in some areas it may not, but also building evidence that once it's built, then can be used to improve the program over time. I think that is a model. I think in medicine, the analog to that, and it's not a perfect analogy, is the FDA process, where in 1962, Congress enacted a law saying that before a new drug could be put on the market, pharmaceutical drug, there had to be basically 2 randomized controlled trials. That's how the FDA interpreted it, showing clinical effectiveness before it could be marketed. And so it wasn't Congress deciding, oh yeah, we're going to fund, statins or whatever. It's not congressmen or staff making decisions. It was sort of bounced to FDA and the experts with the evidence standard built into the legislation, and then the process it becomes embedded in the process.
Yes, I wanted to ask a question. Each of you have referred to the issue of racism as kind of an underlying factor that really kind of is difficult to identify how to address it in an evidence-based way. I'm curious to know, are there any strategies, approaches, evidence, or program or activity that's looking at this discrimination and inequities where racism is a factor, and what is such a program?
That's such an easy question that I want to quickly try to You're asking an incredibly important and deep question of all of us. The Racial Justice Institute uses this beautiful metaphor called the groundwater, which is you walk outside of your house and you have a lot of ponds around there, 1 or 2 fish floating on the top. You don't worry so much, but if there's lots of fish floating on the top, you think there's something wrong with the water. But if you see it in lots of ponds, there's something going on with the groundwater. So sort of the many levels of racism. Like if you really think about the roots, it's the groundwater infecting lots and lots of different ponds, education, child welfare, etc. And we're saying we're going to fix the fish instead of looking at the groundwater and the lakes, right? I think it's a great metaphor for your question. We tend to try to come up with ways to deal with trauma and adverse experiences and chronic stress, toxic stress, etc., as a way to deal with experiences that people of color, children of color have all the time. I think some of our attempts to deal with institutional and systemic racism, like looking at incarceration, for example, looking at how policing is done, et cetera, are ways to start dealing with the lakes. I think you're asking the question of how do we get the groundwater, and what I'm suggesting is it's time for us to think about that in a very, very different kind of way and start thinking about that as a largely white problem. And how do we think about how those of us who are white take up the question of how we ourselves, with help from lots of other folks, begin to think through how that happens. I don't think it's a programmatic intervention per se, but I do think a more systematized look at what does it take to change implicit bias and racialized ideas among those of us who are both identified as white and have a lot of influence and power, I think is a whole promising area we ought to delve deeply into.
Yeah, I just am concerned, that things are laid out from a programmatic perspective, which is like it's always in a neat little box, and it's not. The question of who's implementing each of the programs is as much of a factor as the kind of implementation that they're doing. And until you have professionals who are at least sensitive to the community and understand all of these elements, no matter how many times you, on paper, replicate a project, you're going to still have some gaps and some areas that it just doesn't work. I've been doing community-based practice for, I would at least say 45 years, and have been, all over the country and all over the world looking at programs and communities, and the factors of who is actually implementing those programs, and the relationship with the funding agency. Sometimes the funding agency put too much on the wrong areas, and that can just destroy a program. And so it's a question of really stepping back and looking at what everyone is doing, and having these conversations in arenas that are open for such think tanks or whatever, so that we can really hash it out. Because if you've been around long enough, you've almost seen everything work, and you've almost seen everything fail.
I think you framed it perfectly. It's the work ahead of us.
I'll take one more, just because we're so over time and the food is getting cold. So, you, ma'am, yes.
So I have a question that sort of builds on that, and this idea that in the community there's a lot of research fatigue, that we constantly go in, we constantly sort of pick the communities that we think need help, we study them. And one of the issues that I haven't heard here is how do you sustain funding in a community? Maybe the first effort was not successful, the problem hasn't been fixed. So you may move to another one, or you try another item on it, or you look to a neighboring community. This is a real issue, I think, building on what you're saying about if we're saying, oh, we have to have evidence. There is a certain resistance now to trying to say, I'm going to participate in that study, because you come in, you study, you leave. There's no funding. It's nice to hear that, and I know, Casey, you get into a community and you stay with projects, which is a wonderful thing. But I find that in some of the institutions from the federal level and even the state, just do a periodic funding, and there isn't long-term commitment to say what this gentleman over here said is we need to fix overall the inequities of this problem. We want to commit to lifting up education fairly. So I'd just like to understand how this discussion might lead to a more commitment of funding.
Well, solving these problems is not just a technical problem. What we've been discussing today is the technical side. How can we gather evidence that points the way, and how can we create conditions where the evidence will be used to make better policy decisions? But there's a political side also. It's a matter of political will, and not just our leaders, but our nation. Are we willing to commit the resources to close the opportunity gap, as those community foundations call it? Are we willing to commit the resources to provide treatments, to provide training, to provide supports. And will we do it in a sustainable way? I think these private foundations up here can be catalysts, but ultimately it's going to take collective national action to create sustainable responses to the challenges that we're discussing.
And I would just add, I think also, not to, over make my point too many times, do it again, changing the funding stream. So let me give you a quick example. In New York City, in the Bloomberg administration in the early 2000s, the city started shutting down large, low-performing high schools and replaced them with much smaller high schools that were competitively selected, and students chose. There was an element of school choice. They chose which high school to attend. It was evaluated in a very large citywide randomized controlled trial by MDRC and was found at the 5-year follow-up to increase the rate of high school graduation in the small schools versus the traditional schools, treatment versus control group, by about 7 percentage points. And high school graduation on time and enrollment in college the next year. So it was a big effect. And it didn't cost any additional money because there were fewer people retained in grade for 5 years, at cost of the taxpayer in high school. More people graduated on time. So it's a what's not to like situation, as my mother would say. But the new mayor came in, he campaigned against it, and that was the end. They stopped advancing that intervention, and the school chancellor in New York was asked about the study. She said, well, that's one view, but there are many views. And I think the answer to that is, and that plays out in a lot of different places, I think the answer is it has to be built into the funding streams. Title I funding from the federal government and funding from the state level and all that should have incentives for the adoption, the faithful adoption of programs if there is credible evidence behind them.
And with that, thank you very much.